Good morning.
Good morning.
How are you today?
Good, and yourself?
Good. My name is Ariel.
And I'm Dr. Katzen.
And this is Plastic Surgery 90210. Today we're going to be talking about getting that hot girl summer bod ready.
All right.
It's May right now, so you don't have much time.
Tick tock. Wow,
yes.
May already.
Yes.
Yep.
So let's talk about, the upcoming procedures that you can do to prepare for the summer. We've been seeing a lot of liposuction consults recently.
So liposuction is the most common surgical procedure in the world, okay? More common than anything else. So it's a very popular procedure. It can be done under local anesthesia. It can be done under twilight anesthesia. It can be done under general anesthesia. Really just depends on what you need and what you want to do.
So if someone wanted lipo, they came in today. It's May 13th.
Yep.
Could they get their surgery in and be ready for the summer by like July?
Yeah, it really depends on the patient, the healing, what we're doing. Is there excess skin? Does skin need to be tightened? Your overall general health, etc. But I think that timeline is reasonable.
What would you say the most popular surgeries are for the summer?
Liposuction, definitely. Liposuction, and the other two would be breast augmentation.
Yes.
And probably tummy tucks.
Okay.
Those are probably the top three.
Why is late spring or early summer actually like one of the best times to have surgery?
I think it's great because you're getting ready for the summer. You're excited about the summer. Maybe you got summer plans. Maybe you've got a destination you want to go to, and you want that hot body to match the setting you're going to be in.
Right, and maybe you have some time off that you can take before the summer.
Exactly. Maybe your job allows you a couple of months off in the summer, or a couple of weeks, whatever, and allows you time to build in that recovery.
How long does recovery typically take for like tummy tucks, breast lifts, and liposuction?
Yeah, so for liposuction, it depends on the areas we're doing. If it's a little area, maybe you're going to have a week recovery. But if it's a little bit more extensive, maybe you want to plan on maybe about 10 days, 2 weeks, something like that for recovery for liposuction. If we're doing breast augmentation with a little bit of lipo or by itself, give yourself maybe about a week, 10 days, something like that. If you're doing a tummy tuck with lipo or tummy tuck without lipo, give yourself maybe about 2 weeks.
So for lipo, a lot of people are worried that they're still going to be swollen going into their events or summertime. How?
That's true. Yeah. So with the swelling after liposuction, after any surgery, people get swollen. It's the body's only way to react after surgery is to rush blood to the area, which then secondary causes swelling. Okay, so that's how you heal. That's normal part of healing. With liposuction, is no exception. So with liposuction, we encourage garments. We have you wear the garments for about 6 to 8 weeks, and we encourage lymphatic massage to help move that lymph or that swelling back into the lymph nodes and help that swelling to go down naturally.
Got it. So how long should people give themselves to like not be swollen any longer?
Yeah, so you're going to see the majority of your swelling after liposuction gone at about 2 weeks, the majority of your swelling. But then most of the swelling will be gone maybe at about 4 to 5 weeks, and then pretty much all the swelling should be gone at about 6 to 8 weeks. Really depends on how much lipo is being done and how aggressive the liposuction was. Is it just a little bit of liposuction? Maybe we took out 500 cc's, or are we taking out 5 liters or more?
Yeah, and you often do Vaser liposuction. The results look great. I feel like those people tend to be less swollen for a long period of time.
Yeah, so Vaser is more aggressive. It, again, heats the skin and melts the fat. It's sort of a dual thing. And usually we're etching out the muscles. So the Vaser has been known in a lot of medical studies to actually show decreased swelling compared to traditional liposuction.
Interesting.
Yeah.
And that's because it's just less trauma to the area?
Nobody really knows, but there is less swelling with the Vaser.
Okay. All right, so if you really want to get your body ready within the next couple of months, you would recommend the Vaser?
Yeah. Yeah, so I really like the Vaser. I think it gives better results than traditional liposuction. I like to combine it with the micro air power assisted liposuction, which helps to vibrate and dislodge the fat even better with the Vaser.
Right. And what about breast augmentations or breast lifts? Is now a good time to get it to be ready by like July?
Yeah. So again, with the breast augmentation, you're going to give yourself at least a couple of weeks to heal. You want the implants to settle. You don't want to be in too much pain when you're at the beach showing off your results.
What does settling mean?
Settling. Yeah. Sometimes after the surgery, the implants, because of the nature of the surgery, will ride high. Okay, so sometimes if you're placing the implant partially or completely underneath the muscle, when we talk about the muscle, it's the pectoralis major muscle. When that muscle contracts, it drives the implant up. So sometimes immediately after the surgery, or even about a week to 2 weeks after the surgery, the implants are riding high. So we need to massage them down, or have straps, or mobilization of the implant to keep the implant down. Some people will say, my breast implants never dropped or fluffed. All right, that's because they were too high. So you want to be sure that the implants have time to settle into their pocket before you go out on the beach.
So how long did you say you need for it to settle?
Yeah, usually settling should be on the table or at least a couple of weeks after the surgery. So at least maybe about 2 weeks.
How long do patients have to be in town after these summer procedures, like
Yeah,
go breast?
so it really depends. So with liposuction, typically I like my patients in town for about maybe like a week to 10 days just to make sure there are no untoward problems before we let you go back home from where you came. If you're an international patient, maybe we want you in town for about 2 weeks because the flights are longer and we don't want you to have any problems.
Okay. What about for the breast aug?
For breast augmentation, we typically like you in town in Los Angeles for about 10 days.
How do patients' lives change when they hit the beach or pool post-surgery and feel confident in their bodies?
Yeah, so it really depends on the patient, but we get amazing stories of, wow, Dr. Katzen, you know, I haven't been to the beach or I haven't been to the pool in the last 10 years because of my body, and I'm so happy with my results. Now I'm proud of my body and can go out on the beach and show off my body. So we get these stories all the time, very, very happy.
I think about one of our patients who, you know, she said she hadn't worn a bikini in 20 years, and she sent us a picture, and she looked so good. And she was just like posing, and we're like, yes, it was so great. It was a nice red bikini. She was so happy. And she was with her family at the pool.
Yeah, so we get these stories all the time, and patients are very proud of their results, very happy with their results, proud of their new body, and, you know, whether it's maybe weight loss or maybe changes with aging or changes with pregnancy, you know, these are things plastic surgeons can typically fix.
What do you say to patients who are on the fence about scheduling now versus and like waiting till next year?
Yeah, I always say, you know, do it now. You know, why wait? And one of the most common things patients say is, you know, I wish I'd done these procedures sooner or earlier. So if you're thinking about it and you're healthy and you're motivated and you don't have medical contraindications, I'd suggest do it sooner rather than later.
Yeah, I would get the new pair of shoes ASAP so you could wear them as long as possible.
That's right. There you go.
So is it possible for people to book surgery now in time for summer?
Yeah, definitely. So just call the office. We'll get you a consultation, whether it's physical or virtual. We'll figure out exactly what surgery you need, and then we'll look at the schedule. So it is possible to get you in quicker. It just sort of depends on my schedule and your availability, and also your medical clearance. Before we do any kind of surgery, even liposuction, we check your blood, EKG, chest X-ray, make sure you're healthy for the surgery. But it is possible to get in fairly quickly. Basically, if you're wanting surgery, give us a call. We'll figure out what you need, and then we'll figure out when to get you on the schedule.
Alrighty, well, if you're considering that summer surgery,
book it now.
Katzen a call. Yeah, book it now.
Yeah.
And you can ask all your questions during your virtual or in-person consultation. These consultations are with you, not a PA, not a nurse.
So they're with me. I examine you. We look at you, you know, physically or maybe virtually on Skype, Zoom, FaceTime, etc. Maybe you send in pictures ahead of time, but it's with me.
Okay.
Yeah.
Great.
So if you're thinking about liposuction, at least get a consultation. Maybe you're not doing the surgery right away, but at least you get some ideas of what you need, what it costs, and what the recovery looks like, so you can plan.
And if you miss the summer cutoff, fall's not a bad time to recover either.
Yeah, or winter, or spring,
or anytime.
or anytime.
All right. Well, nice talking to you guys, and we'll catch you next week. Thanks for watching Plastic Surgery 90210.
Give us a call.
Bye.
Bye.